friends, my name is Karen. I'm going to be your nurse today.
Hi, Karen.
Hi. We're going to do an examination. We're going to concentrate on your abdomen, on your GI system. So I have some questions I wanted to ask you before we get started on that. Would that be all right?
Mm-hmm.
And I'm going to videotape this examination. Is that all right?
Yes, that's fine.
Okay. That's great. Now, what is your age?
30.
Okay. 30. That's great. You had any abdominal problems?
No, I haven't.
Okay. No unplanned weight changes, like weight loss or weight gain?
No, not really.
Okay. Have you had any, or do you have any special dietary needs?
No.
Not on any kind of special diet for any reason?
No.
Okay. Have you had any fever, chills, or dizziness?
No, just pain.
Where's your pain? Can you put your hand where it is?
It's kind of just all over.
Just all throughout your whole... Okay,
Mhm.
we'll take a good look at that in a few minutes. Just have a few more questions. Can you tell me a little bit about your family history in terms of any gastrointestinal problems?
I don't think there's been any in my family that I can think of.
Okay. No first degree relatives like a mom, dad, grandpa, grandma with colorectal cancer or anything like that?
No, my dad had cancer, but they didn't know where it started.
Okay. Any GERD, acid reflux type issues in your family or bowel disorders that you know of? Okay. And you said that you're 30. Okay. Do you have any transfusions that you've ever had before?
What's the transfusion?
Oh, well, I'm sorry. It's like, have you been in the hospital and you've been given blood?
Oh,
for any reason,
no,
no?
no. Mm-mm.
Okay.
I'm scared of needles.
Oh, okay, yeah. Not many people really like them a lot, so we'll try to make that as smooth as we can. Hopefully we won't need to use one today. We already have all your labs, so. Do you personally have any kind of history of cancer?
Oh, no.
Abdominal surgeries? No
No.
C-section?
Oh, I did have a C-section.
Okay. Do you still have your appendix and your gallbladder and all
Yes.
that?
Mm-hmm.
Okay. All right. Have you ever had any kind of eating disorders?
No.
No.
I like to eat.
Okay. But no vomiting, no anorexia.
I've been feeling nauseous, but no actual vomiting.
Is that nausea? Is it associated with when you've been eating, or is it just kind of going on all the time?
Going on all the time.
Okay. Can you think of anything that brings it on?
No,
Tell me about what relieves it.
it's nothing.
Nothing. So you're having an ongoing problem with that.
Mm-hmm.
When was your last menstrual period?
I had a hysterectomy.
Okay. And what year was that?
2 years ago.
Okay. Okay. And can you tell me about any medications that you take on a regular basis?
I don't take any.
Okay. No hormone replacement, anything like that?
I'm too young for that. I'm only 30.
Okay. That's true. But you did have a hysterectomy, so maybe they left your ovaries in place?
Yeah,
Okay.
no, I don't take anything.
Okay. Tell me about your occupation.
I'm a teacher.
Okay, great. Have you had any foreign travel recently?
I wish, no.
Okay, yeah, me too. Anything about your lifestyle that we need to know? For example, do you drink alcohol?
No, I don't.
You don't?
No.
Okay, all right. Tobacco, do you smoke?
No, I quit.
Okay, how long ago?
About 5 years ago.
That's great. You should be really proud of yourself. That's not easy to do. Good for you. Let's see. I wanted to also ask you about any recreational drugs you may have used in the past or currently.
Like, what's considered recreational?
Like marijuana,
Oh, yeah.
cocaine, anything. So you do smoke marijuana? Okay,
Mhm.
okay. How often?
Weekly.
Okay, like on the weekends?
Yeah.
Are there any other recreational drugs that you might use?
Oh, no.
No meth or
no. Oh, no.
cocaine,
No.
nothing?
Just marijuana.
Okay. All right. Have you, just a few more questions and then we'll get to the examination. Have you had any trouble with heartburn or bloating?
Not heartburn, but I do feel bloated.
Okay. Are you having gas? Like a lot of gas without any gas?
No gas, but it almost feels like maybe it's like trapped or something. Trapped
Okay.
gas or something.
So like an unpleasant fullness?
Yeah.
Sort of? Okay.
Mm-hmm.
All right. And you've been nauseous, but you've not had vomiting.
Mm-mm.
And you are having abdominal discomfort. Would you characterize it as pain?
Mm-hmm.
On a scale of 0 to 10.
Oh, it's a 10.
It's a 10. Okay. Do you have any difficulty swallowing?
No.
Any diarrhea?
Mm-mm.
No. Have you had any urinary problems? Is your urine yellow, clear?
I haven't noticed anything.
Okay. Do you have any urgency or frequency? Meaning, like you're going all the time, or?
No,
Okay.
no more than usual.
Okay. Do you have any incontinence, like do you leak, like when you sneeze or cough
Oh,
or
no.
laugh? No.
No.
Okay. All right. Well, we're going to get to the physical exam part of your assessment, and I'll be back in just a minute. And we'll
Okay.
let you get your gown on, and there's a blanket here you can use.
Okay.
Okay.
Thank you.
Thank you. Hey, Miss Jones.
Hi,
you all?
Karen.
Hey, are you all ready for your examination?
Yes, I am.
Okay.
My stomach's killing me. I can't
I'm
wait for you to
sorry.
figure out what's wrong with it.
We'll keep you covered up with this blanket
Okay.
for some privacy.
Okay.
But I do need to inspect your abdomen.
Okay.
So I'm going to look at your skin color and your umbilicus, your belly button.
It's right here.
It is, isn't it? Okay. And I'm just looking for what we call peristaltic waves. That's the kind of motion that your intestines make as they digest and move food along in your digestive tract.
I did just eat.
Well, good. Then we'll hear some good bowel sounds when I listen. And I'm looking for color, shape, symmetry. Okay. Now I'd like you to take a deep breath for me and kind of bear down. Okay. Okay, good. Good. And what I was doing with that is I was just checking to see if you had any signs of any hernias.
Did you see any?
I didn't. Has that been a concern of yours?
No, I just got concerned all of a sudden.
Oh, I didn't mean to alarm you. I'm just trying to explain what we're looking for. And your stomach doesn't appear to be distended. I know you said you have that kind of full
Oh, it
feeling.
feels like it. Oh, yeah.
Okay. And I'm just sort of watching your respiratory pattern. And it doesn't look like you've got any like fluid in your stomach, ascites. That would be from, problem with your liver. Okay. Now I'm going to take a quick listen. And I'm going to be listening to each quadrant of your abdomen, just listening for bowel sounds. And then I'm going to be taking a listen to 7 points on your abdomen to listen for your vascular sounds. Those are sounds from your vascular system, like your vessels, your blood vessels. So I'm going to do that. I warmed my stethoscope just for you.
Oh, thank you.
You're welcome.
I was concerned about that.
I can tell. Wow. You have very good bowel sounds. Okay, so I was just listening to all 4 abdominal quadrants, and we want to just make sure that the sounds we're hearing are equal on all sides, and that helps us to recognize if you are having any kind of an abdominal or colonic obstruction. And you're not. I can hear all your bowel sounds equally on all sides. So now I'm going to listen to those vascular areas. Okay, very good. Now I just want to listen while I tap on my fingers. It's called percussion. I'm going to percuss different sounds, like, for example, I can tell if your bladder is distended or full or what have you by doing that, and just different things about your abdomen. So. And now I'm just gonna feel your structures under your skin, like I'm gonna feel for your liver and your spleen, and just see if there's any abnormalities I detect, or if you have any tenderness. Okay. Where are your ribs? Here they are. I'm sorry, I'm tickling you. Okay, there we go. I'm not tickling you now.
I know.
Okay. Any discomfort here?
No.
Or here? Tickle. Sorry. Okay. All right. I think that just about completes our examination.
Okay.
Okay. Do you have any questions for me?
Nope.
Okay. I'm wondering if maybe I'll make sure the doctor takes note of the discomfort that you've been having. I'll mention that to him to see what he thinks we can do for you as far as that goes. But
Okay.
we'll see if we can't get you something for that. But no other questions besides that?
Nope.
Okay. Well, he'll be in just a second. Okay?
Okay.
Just let me know if you need